Hi, and welcome to the Navigating Neurodiversity podcast. I'm Vivian, registered psychologist, and today's guest is a music therapist, Jacqueline Chow. Welcome, Jack.
Thank you.
Okay. So Jacqueline is a registered music therapist and the founder of Combrio Music Therapy, and she's also an adjunct lecturer at the National Institute of Early Childhood and a program lead at the Methodist School of Music. So Jack has worked in early intervention, special education, as well as pediatric rehab and mental health sectors in Australia, Hong Kong, and Singapore. So I'll link Jack's website in the caption below where you can find her full bio as well as learn more about Combrio Music Therapy. Okay, so today we're going to be talking about how music therapy supports children of all abilities, including our neurodivergent kids. All right, but before we dive into the topic, I'm going to first ask Jack to share a bit more about her background and your experience and what you're currently busy with.
Thank you, Vivian. Thanks for inviting me over here.
Thanks for coming.
I've been a music therapist for about 15 years. Yeah. I'm originally from Hong Kong, and I was an exchange student in Austria when I was 16 years old.
In
Austria.
Austria.
Yes. So when I went to Austria, all I wanted to do was music. I actually wanted to do film music, but my mom, she was a banker, so she was sharing with me that you should look for a job that can support you as well. Like, although passion is good. So then I went back to Hong Kong after 1 year. I was still venturing into all sort of possibilities that go with music. But I went to a business school. So I actually studied accounting and everything related to business. But I was not interested in any of those things. So I tried my very best to get out of it. So while studying in the business school, I was doing choir, conducting, singing, and then I found out there's the music therapy program in Australia, and we didn't really have much money to go for further studies, so I just tried. I went to look for the audition program and I looked at the criteria, so then I went straight to apply without telling my mom. So I just applied for it. After that, I told her, these are the possibilities that I can actually go for. And then I knew that I had to go for an audition. So I told her that I wanted to quit secondary 6. Back then we had to study 7 years at secondary school in Hong Kong. So I told her that I wanted to quit and just spend all my energy and time into preparing for an audition CD. So I had to do practice and do recordings. So then in the end, it was a very, very long story. I couldn't get in. So I couldn't get into 2 universities because they needed a foundation program. They needed foundational years.
So you sent in your audition tape, but they said you needed the...
Yes, that's a basic requirement.
I see.
So after that, I received 2 letters, and I was really disappointed, of course, but then it was a lesson that I learned. Then I went back to school. I went back to beg my principal, can you please let me come back? So that I would just use 1 month to catch up with everything that I have missed out. After I caught up with everything, I received another letter from UQ, from the University of Queensland, and they accepted me. Yeah, so it was like a miracle.
So they rejected you and then they accepted you?
University of Melbourne rejected me. University of Western Sydney also rejected my application. There were only 3 universities offering music therapy course.
See. So UQ came back.
Yeah, so UQ came back. So it was an unconditional offer. So it was, it was like a miracle, and like nobody knew how could that even be possible, because everybody was talking about you must have your entry requirement, which is foundational years or A-level exam. So I did not have any of those.
Right.
Yeah,
it's
so
just
then what I had was music-related qualifications, and also I went to Austria for 1 year that could complement. I'm not sure why. There was no explanation. So then I went in, and I knew that was it. Like, if I do not grasp my opportunity, that's just something that gave me. And then, so I went into the course, and it was a 4-year bachelor degree. So first 2 years I studied piano and everything related to music. For some of the electives, I did psychology, children's development, child psychology, and those courses related to the brain. Third and fourth years, I was studying with 12 master students. There were only 2 undergrads. Only 2 undergraduates and 12 master students. So 14 of us did the entire program together.
Right.
Yeah.
So it was like a merge.
It wasn't, because for the master students, usually they are mid-career change. So some of them entered as a nurse, or they have other related or unrelated backgrounds, but they wanted to look into music therapy. So for me, it was a bachelor degree. And right now, there is no more undergrad program in Australia.
Okay,
So only have master's level, because they felt that a lot of us are not mature enough to see the cases that we had to see. So I would say the last 2 years of studies, it was really, really difficult. How old was I? I think I was 21 when I was in year 3 uni, 21. And for the clinical placement that we had to go for, it was adult disabilities. And then I went to 3 facilities with children rehabilitation at the hospital. And one of them was a mental health facilities. It was the most challenging for me, the mental health facilities. So for me, going into music therapy, part of it was because of my upbringing. So I had, I'm like sharing a bit so much about my background.
That's okay. No, that's good.
So how did I even get into music therapy or even choose about such a niche profession was, it was a really, really long story. Part of me is I was very interested in social work and psychology, because my late father, he had a lot of anger issues. So I grew up in an environment that was I was really suffering from a lot of child abuse. My mom as well. So it was domestic violence. So growing up was very difficult, very, very hard. And then growing up, I was living with my aunties, different aunties, and one of my aunties' family where my cousin, he was born with severe hearing impairment. So I am 7 years older than him, but we grew up together. So I've seen how he grew from an infant all the way now. He's already finished his master degree in architecture. So I have really seen the whole spectrum of how therapy can help somebody. He was really in intensive speech therapy every day. And I think learning English is hard. Learning Cantonese is even harder, because we have 9 different tones.
All the tones. That's right.
It was really, really tough. And when he was growing up, he also went for music therapy. It did not help him. Music therapy. So when I came to know about music, and there's music therapy, this profession, I tried to analyze what was the reason that it did not help him. What made him not to like music? It was like forcing him to learn in a way that he is not used to, and it was really loud for him. And it is not his interest, not his passion. So when I went into that field, I tried to analyze what's wrong with the approach and why is it not suitable for him. So then now I come to realize that there are many different approaches that music therapists actually practice, or we learn different school of thoughts. And the approach that I learned from Australia is eclectic approach. So we do what is best for the child. And I think over the years, I've also learned that following the child's lead is something that's very important to me. What is suitable for the family and for the child.
So kind of having a tool bag and then having different tools and then customizing to the child, rather than having a very strict kind of handbook kind of approach that you follow, right?
So I think all these things just shaped me into the person I am and how I entered into the profession.
Thanks for sharing that. No, that's really, the more people I talk to, the more I realize that many times for a lot of us in, professionals in the field, it's like our personal lives and our personal circumstances have kind of, led us to this profession that we're in today. So there's
Yes,
always a
yes.
story behind. Yeah. So thanks for sharing that. Yes. So I was also thinking about how music is a very established domain in child development. In countries like Singapore, Hong Kong,
Yes.
where a lot of parents will send their kids for music classes. It's like a must.
Yes.
Piano, violin, and things like that, right? So I thought the term music therapy, parents might be like, what's that? How is that different from
Yeah.
like the music classes that I'm sending my kid to? Yeah, so maybe you can explain a bit
Sure.
about music therapy.
So music therapy is an evidence-based and clinical use of music to achieve functional outcomes. Yes, so which means that it's not so much about musical learning outcomes, only if musical learning outcomes is functional for that child,
Right.
then it makes sense. So what it really works is music therapy, we go in, and we'll have to give you some examples. If it is a child, 2 years old, a 2 years old child with cerebral palsy, for example, most of the cases that I've been seeing have CP. The children are diagnosed with CP. What I do is I do not teach the child to sing, or I do not teach the child to play a musical instrument, to learn a song. It's not so much about learning musical outcome. And speaking of which, 2 years old, you don't really teach them per se. So I will make music with them, and the way I do it is I meet the child where the child is at, and I will assess what does the child need at this stage. Is it social skills? Is it language? Or is it gross motor? Or is it social emotional skills? Or is it about coaching the family of how to support the child? So it's not so much about musical outcome. But of course, they will love music eventually, so it is a bonus if they learn something from that therapy.
Yes, yeah. So that's a very clear explanation. So in terms of the goals, it's not like my child is gonna, achieve grade 8 in violin and music and so on, but it's more about the use of it to achieve certain therapeutic goals that you've set with the child. Okay, Jack, thanks for the very good definition of music therapy. I think it helps to clarify. So maybe we can give our viewers some idea of what a music therapy session looks like. What are some techniques that you employ in your lessons?
Yes. So right now I'm doing home-based music therapy. So I will see my clients at their homes for about 60 minutes usually. So a lot of people would question, my child's so young, can he or she sustain that amount of time, attention? So the way I structure my session, I will always have about 8 to 10 activities that is music related. So it always starts with the hello song and with the goodbye song, and in between there are many different activities that targets our fine motor, gross motor, something like dance. We call it dance because we don't name it gross motor to little children.
Yes.
But it could be because the child has a need to hold a pencil, but is not doing it because he needs more input on the proprioception of the joints. So then we'll be doing a lot of gross motor activities, using the whole body, like doing a lot of bear walks, a lot of rolling, a lot of proprioception and vestibular input together with music. So how do I do it is, it could be yoga position, but mapped with music, with a theme. So the child doesn't know that he is in a therapy session. He only thought that he's playing games with me.
Yes.
And then all these goals are all
kind of infused into the session.
Yes.
Okay.
So then we have that gross motor, or we call it dance, and we play musical instruments. So musical instruments is most of the time improvisational. So I take out a whole lot of musical instruments, like could be drums or bells, press bells, desk bells, or some instruments that can give melodic sounds. Some of them are just percussive sounds. So I don't teach them how to play. I don't hold their hands. I just model and show, and then I will match the child at where they're at. If the child is playing fast, then I will match that pace and create my music on the guitar to match that. Then we can continue to expand on that. And most of the time for young children, you will see that they will be in that musical environment for a little while. They will be singing. For children, I just mentioned about cerebral palsy. If he has gross motor difficulties, you'll be surprised he can actually stand independently and hold the instruments and play with both hands bilaterally without anybody holding and telling them, oh, you need to use both hands. We don't really use so much verbal directions, but everything is through play and musical prompt.
I see.
Yeah, so it's in a fun way.
That's so
And
interesting.
after all these super loud sections, I will always do a calming section.
Right.
Yeah, need to calm down
Yes.
and teach them about co-regulation strategies or talk about different vocabularies of how they can express themselves or how to breathe. Yeah, but really use just through stories and songs.
I see. Wow. So you teach emotional regulation strategies, you do motor skills with them. It sounds a little bit like OT infused with music as well. That's really nice. So so Jack, in the early intervention space, right, we often, I guess people are very familiar with things like speech therapy and occupational therapy, ST and OT, and perhaps in general maybe less familiar with things like music therapy and art therapy, and yet we have seen how kids can really benefit from these therapies as well. So maybe let's focus in on our neurodivergent children and perhaps those with developmental delays. What kinds of profile do you think would really benefit from music therapy? Yeah.
So one of the roles that I do is I do consultation at early intervention centers. So sometimes I'm invited to go in just for a one-off session. And when it is a one-off session, I realize that every time when I just sing with no instrument in a very calm voice, immediately the neurodivergent children will tune into me. Yeah.
That's
So-
the power of music, right?
Yes.
It
So
just
I think
draws
that
them.
The science of music is that music is processed across all regions in the brain. So it's not just one particular area like speech. Speech is processed primarily in the left. And for music, there is melody, timbre, rhythm, and all those things. They're all processed in different parts of our brain. And so most of the time when we are using our words to say one command, the children are not listening because they can't hear us. It just fades. The word just fades. But when you sing a song, it activates the whole brain. Then you will realize that, children with neurodivergence, they will just turn around and look at us because we sing. So I think that's one power of music. It activates the whole brain. But at the same time, we cannot overuse it, because if you overuse it, it will not have that power anymore. It becomes stagnant.
Right.
So in a preschool setting, when I'm working with a group of children who are neurodivergent, we will have to plan our session by matching the energy level of the children. So if the children are high energy, we will use our music that is more high energy music to match them. And when they're a little bit lower, we will make our music a bit softer. So I use pre-recorded music only when I need it to show a certain, for example, classical piece of music. Or it could be like a yoga song that I need help with because I'm doing the actions. But most of the time it's really through live music making. So it's in the moment. So a lot of children who are neurodivergent, or if they have intellectual disability, they just love us so much immediately because we're making music with them. We tune into them. Our mirror neurons just move at the same pace, and we sort of we understand each other at that moment. So we bond very, very quickly. So this is something very powerful. We always tell new moms who just gave birth to their babies, the best way to bond with your child is to sing to them.
And I think that's cross-cultural, isn't it? It's really a universal language. So in terms of profile, it sounds like the cerebral palsy you mentioned, intellectual disabilities, children on the autism spectrum as well.
Yes.
Do you work with them also, and what have you observed in terms of how they respond to music? Because I definitely have clients, they're so sensitive to music, and maybe you can share.
Yes. So for the children who are autistic, they have this very special love for music. Not all of them, majority of them. Some of them even have what do you call this? Like they are just so good at that. They can tell you what key a certain song is played in.
Perfect pitch, right?
They have perfect pitch, and even when they're very little, 3 years or 4 years old, they're able to play a certain tune on the piano. But they don't have the fine motor skill to play it as well as like an adult who's trained in piano. Through the music, we can communicate. We have a lot of musical jokes. And I think it's important even for children who are on the spectrum, they need to bond with somebody. It's not like they're entirely antisocial. They aren't antisocial. It's just the way that they socialize is different. So for that moment when we can communicate with one another, and you will see a lot of smiles, a lot of eye contact that are not forced. We don't really look for any eye contact type of goals anymore. But of course, you know, when somebody likes you and likes the music or the materials that you present, they will look at you.
Yeah, it emerges naturally, right? Yes. Mm-hmm. Tell me more about the musical joke. Like, how does that look like?
Okay. Yeah. So musical joke. So I've got this little boy. I see him once a week, and he particularly likes In the Hall of the Mountain King. Da 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 da. Yeah. So the musical jokes would be at the end of the song, and went bop 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 like that. So then
something unexpected. You mean like
that musical motive. So he would look for instruments that can create these two type of sounds. Right. And it would bop bop bop. So if you are not musically trained, but you are a therapist, you may not be able to pick that little musical joke that the little boy initiates.
Oh, I see.
Yeah.
Right. Mm-hmm. So he will initiate that, and then you would have to pick it up and respond to that. So it's like
and expand.
Yeah, so you know, we often talk about reciprocity, you know, the back and forth kind of interaction. So that certainly can occur in music as well without the use of any verbal language. So I can imagine kids who are perhaps not yet verbal would really benefit from that sort of an interaction that doesn't require them to use words.
Yeah,
right.
And I'm also very surprised because sometimes the children who are referred to me, they are seen as non-speaking, but actually they have the words. It's just that they choose not to speak. But in our session, they are so comfortable that also the materials is what they like. Then they are expressing themselves a lot.
Wow.
Yeah.
Okay, that's lovely. Okay, yes. So I wanted to, you know, also ask about improvements and progress. You know, what sort of improvements have you kind of seen, maybe in the children that you've worked with, as well as maybe what science tells us, right? Because you started off with saying that it's evidence-based and so on. So I'd love to hear more about that as well. So anecdotal as well as the scientific.
I'll share with you my experience first, what I have observed. One of the cases that I used to see was a child, also 2-year-old. They always refer to me at 2. I'm not sure why. And then I will see like a 2 to 3 years type of progress because I'll see them weekly. It was a little boy. He's got some brain issues, and so he was not responding to a lot of things in the environment. Parents also not sure if he's able to see or not. But we just press on, and weekly we continue to give him the live music. And what we notice is whenever we play the drum, his eyes will open up brighter. We're not sure if he can see or not, but we can tell from his eyes and from his smiles that he can hear. Or it could be that we hold, or we hold his hands to play the drum. He could feel the whole vibration in his body. And then towards, I think, when he was about 4 years old, saw him for about 2 years, and we realized that he's also very encouraged to lift up his head and to move left and right, to track the sound. The difference between a therapist and parents noticing the difference is that we see them once a week or twice or once in 2 weeks, whereas parents see them every day. Sometimes for the tiny little improvement, they can't really tell.
True.
So it's up to us to give them back the progress report at the end of like 8 to 10 sessions. Then we tell them 10 weeks ago it was like this, and now these are the improvements that is being made. So the improvement was very small, very, very subtle, but it was huge for the family.
Yes.
Yeah.
Yes.
And also, when we are singing a hello song, sometimes we just wait for a response. We cannot force them to make any sound, right? You cannot, like, a lot of teachers would say hello, but a lot of young children don't just say hello like that, right? You need to wait for them to naturally respond to you, and they're able to match the pitch. Yeah, so for example, I'll say hello, and then the baby would say but it takes time.
Right.
Yeah, so
right,
these
right.
are small little responses that we can see an improvement.
Right,
Yeah.
that's really
Mhm.
nice. How about in terms of the
In the
literature?
research- so music therapy is research based. A lot of research is done in the overseas countries like the US or Australia. Right
Yeah.
now in Singapore, we are kind of small, but right now this year we start to have our local trainings at UAS. It's a master degree program. So we are looking forward to more research in the area of a special education. Yes. So from overseas research, what we have learned is that music therapy is used in the IEP of the children, the individualized education program, and it is helped to improve joint attention, coping skills, their language skills, socialization, and auditory processing. We also help them with their academic and cognitive skills as well.
Great. Yeah, so we're looking forward to more local research that could
Yes.
inform practice as well. Yeah. So, as you were sharing the examples earlier, I just thought like there are elements of OT. I mean, there's speech involved as well. So I just thought how nice, if like music therapy, the OT and the ST perhaps can get together and plan sessions. So, do you have experience of this, like working and collaborating with other
Yes.
professionals?
So, yes, a lot of collaboration. When I was in school settings, I used to work with SLT a lot. So the speech therapist would plan all the speech-related goals, and I would be the one planning the activities. Yes, and then it is harder for an SLT to run group sessions for neurodivergent children or autistic children in a group setting of 8 to 10
Yes.
without a musical structure or a prompt. So what we used to do is we will work on social skills, having everybody following one step or two step direction in a song, and the SLT would be there to draft the goals and guide the children what they need to do, or requesting for certain objects or musical instruments using packs or picture cards. Or forming the sentences depending on the individual child as well. So that's collaboration with SLT. And for PT, usually I will be the one engaging the child for a certain type of exercises that they have to do.
PT would be the physiotherapist?
Yes, the physiotherapist. For example, if there's trunk rotation, then we'll be thinking about some songs that we can incorporate session movement, or moving their arms up and down. Then we will add all the songs, all the exercises or activities into the song. All the different movements that we need to do.
Yes. I just think that's so great for bringing in the motivation component, because I mean I have therapist friends, and sometimes it's hard for them, like you said, to achieve maybe purely speech goals or OT goals, because the child may not be interested, in the activity that you have planned. And I think bringing music in could be a great way to really engage them and get them, and they don't, like you said, they don't even realize that it's a therapy session because they're just having so much fun.
We actually did one very interesting case as well. It was for a child for school transition. So I work with a psychologist. Yeah, so we brainstorm what are the possibilities that the children may face when he goes to a new school. And so I was working on social-emotional outcomes. And we brainstorm and we prepare the child. We create some social stories. We put songs into the social stories. And we did some songwriting as well to boost his strength and teach him how to introduce himself to others. And how to respond when people may use negative words to attack you, so we did that as well.
So how do you bring music into that? Like, for example, handling bullying or teasing by friends. Yeah.
We usually start with understanding what the child is thinking at the moment. Most of the time they would say, I don't know, because they're very shy to really express how they feel, or they're quite confused, or they don't have enough words to express. We'll be listening to many different types of songs that talk about the same theme. For example, existing songs that we already have about change or going to our new school. If there isn't any, then we will take a song that he likes and we change all the lyrics. Yeah, change all the lyrics. For example, the boy that I used to work with, he was 8 years old. He was somebody with multiple disability and moving out of special school to a mainstream school because mommy wants him to have the best opportunity, just try. So the whole team was very worried for him, not sure how he's going to cope. A lot of the comments said that the mainstream school is going to crush him. A lot of the voices came from behind it. So SLT was doing mounting an iPad on the wheelchair because his speech is unclear, so he needs AAC. So PT, OT, they have their jobs, they have their roles to help him. So nobody looked at his social emotional issues, right? Then the psychologist and I came together. We thought that this is very important, otherwise he doesn't know how to cope when he's in a new environment. So then he really likes Spider-Man. At that time he was 8 years old, so we took this Spider-Man song and we changed all the lyrics. And we also when changing the lyrics, it's like I would already have changed some to try to bring out certain, it's like a CBT type of cognitive behavioral therapy type of approach. I changed some, and then like words to describe yourself is for him to fill in the blanks.
Oh, I see. Yeah. Yes. So it's like a co-production, like you're writing the lyrics together with him.
And then after that we record the song. Last time we're still recording CD.
Yes.
So then we record the song, put into CDs, and then he gets to listen to it in the car when they are driving. And he also has this little storybook about himself. So when he goes out, first day of school, somebody different that goes into the classroom, he has materials to tell friends who he is. What he,
That's so nice. It just gave me an idea that maybe, because we do social stories a lot, and maybe making it into a song would really be helpful for kids, especially those who love music and that really speaks to them.
And also listening again and again reinforcing
Exactly. Yeah, because sometimes it can be boring reading the same book over and over again, but people don't mind listening to songs, right? So we talked about professional collaboration with other professionals. How about with families and with parents? How do you involve them in your sessions and work with them towards the goals?
Recently I had a new case. It is a little boy, he is 3 years old, and when I went to the house, the whole family just came out and joined all the musical activities together like a group session.
Oh wow!
Yeah, so it is really nice. The helper was there, mommy was there, and then sister came home from school, daddy also joined in. So at first they were sitting on the side to just observe, and then after that I observed how they interact with one another, because the child will naturally go to daddy, right? So he will naturally go to daddy, and then I will just give a little bit of idea of what type of language or words that you can talk to the son if you want him to say more again, like feeding the parents these words so that they can use it.
I see.
And then the other cases would be sometimes we notice parents try very hard to encourage their children to speak when they are non-speaking, so they might tend to ask a bit too many questions. For example, if they want the children to say, this is a car, then mommy would tend to say, what is this? And then I will have to remind mommy that, how about you tell him that's a car, that's a blue car. So I have to model a lot of languages.
That's right.
And also get mommy to understand, if you only ask him what is this, all he heard is what is this.
And they end up echoing some of them that
so
question.
working with parents about the language that they use. And there's another case, it's really interesting because I saw the family during COVID time, and the babies were 2 years old, and the babies have not really gone out to the society or the environment. There were not enough age-appropriate toys at home. So what I did was I helped to shop I help the family look for
right.
toys, and parents are just ask me, just help me buy, and just give me the bill. So they have this trust. Yeah, because the toys that I bought for the children in the therapy session, we will also use them. Yeah, so I use a lot of music, but not just limited to the musical instruments. I use a lot of physical props as well. So if the child is interested in cars and vehicles, fire engine, then I will use a lot of those toys in my session together with the songs and music.
I see. You know, that's so interesting because I think when you go into the home, you're really stepping into their space, and it really gives you an opportunity, like you said, to notice things about the environment and what might be missing and how you can, so I think that's one key difference as well, like going into maybe a center for therapy, whereas you're there and you get to really give them some input in terms of the child's environment and how that can be improved for greater stimulation as well. So that's really nice. Last question.
Yeah.
What brings you the most satisfaction as a music therapist?
The most satisfaction is when I'm with the family or with the children. I really give my 100% attention to them, and sometimes they don't get the attention from their families or the other people around them. The most satisfaction is we're able to connect. I think the connection is what I really, really like. There were cases where I felt that is enough. I think the child has already gained all the things that I can do with music therapy. He's ready to go out and venture. But parents said no. Even when they were on holiday, they were still asking when you're going to come. Then I reflected, is it because of the way that we play together, the connection? There is no other places that these children are able to find because nobody talks to them the same way. Or even in school, they are not themselves. When they're at home, helpers and families don't play with them the same way. So sometimes it's not just the therapist, but it's the relationship that we have built.
I think you touched on a very key point because we have the same challenge as well as psychologists, that when you have kind of achieved the therapy goals and the child has made improvements and ethically, it's right to inform parents to say, but sometimes that discharge process can be a little bit difficult for a child and for us as well, sometimes we have that strong relationship and connection with them. So how do you handle that? Like, when it's kind of like, yes, it's time to say goodbye, and because you would have other clients as well that need your support.
So in terms of frequency, we would reduce. We don't have to
so you fade it over time.
Yes, and at the same time, I would help them find some other places where we can continue to work together, but in other settings.
Sure.
So right now at the Methodist School of Music, I started an inclusive choir. So some of the children I work with, I invite them to go to the choir so that we can continue to make music and we will still see one another.
Right. Can you tell our viewers more about that, the inclusive choir?
So the inclusive choir is once a week on Friday, 3 to 4 p.m. Something very special about the choir is we do a lot of musical activities, and I plan it the way that I would plan a normal music therapy session, except that there's vocal warm-ups, like you still have the like those things, and there's also singing outcome where we will perform. What I meant about usual music therapy group is that there is social skill component. Everybody gets to play together, practice social skills, and there's bonding component with the family because family and caregivers are invited to join. So that, for example, just last Friday we sang this very special song. We encouraged the father, mother, and the child to dance together in small classes, and then we form back into one big group. I thought sometimes parents need this acknowledgement and reassurance as well that this is my little child and I still love you regardless. So we work on small little things like this, very subtle, and also we speak very respectful languages. We had a fight in our group among the children. And after that, there is this mommy. She was really kind. She brought the child out. She spoke to him for a long duration. After he came back and he sat in the circle and he said, I want to make an apology. So that's what he said.
Aww.
Yeah, I thought these are some of the social skills that we would not be able to learn in other settings.
Yeah,
so it's not so much about the children learning to be with one another, but the parents and the families. We're supporting families.
Yes.
Yeah.
Is there an age group? Like if people are interested to join?
Yes.
Yeah.
So the age group, naturally, right now we have 4 to 8 years old. Those are children who come to us. They are within this age group. So
4 to 8.
naturally it's 4 to 8. We will welcome those who are younger because caregivers are there as well. It can be like a language group for them.
Sure.
Yeah.
Okay. So Methodist School of Music. We'll put the link down below as well. Yeah.
Great.
Thank you so much, Jacqueline. It's been so insightful and sharing with us about music therapy and the role that it plays in child development regardless of abilities. Thank you for tuning in today, and if you've got any questions for Jacqueline, put it down in the comments below. Thank you and goodbye.
Thank you. Bye-bye.
No, you're talking like I'm sweating,